Huh? Huh? My packet is here. I cannot drink for them. So maybe put in the fridge for me. Okay, coming. Less than 3 minutes.
Good morning and good afternoon. Welcome to Asian Productivity Organization Productivity Talk. Now, broadcasting live on air from Tokyo, Japan. My name is Watanabe, Agriculture Division, APO. I'm today's navigator. Nice to meet you, everyone. Today's topic is COVID-19, impact on food supply chains in Asia. The pandemic changed the life of people. Under the pandemic, the most important is to prevent infection other people. So people need to stay home and to stay away from human interaction. Such behavior affects our food supply chains from both demand side and supply side. Consumers refrain from eating out and joining in events, and supply chains need to adapt to the new lifestyle. In Asia, February to May is a celebration season. Food businesses earn a big part of their profit in this season. But the pandemic hit such food businesses. So the damage on Asian food businesses is especially big. Today's productivity talk will tackle with such a challenging issue. I hope you can enjoy it today. If you have any comment and question to our resource person, please put it in YouTube chat box. You can put it in for 2 weeks from now. We choose some questions and comments to respond. Then, if time allows, we will respond some of them today. Other ones will be responded through this YouTube later. Now, let me introduce today's resource person. Today's resource person is Dr. Rodney Wee, Chief Executive Principal Consultant, Asia Cold Chain Center from Singapore. Good afternoon, Dr. Rodney Wee.
Good afternoon, Watabe-san.
Okay, please present us.
Thank you very much. Good afternoon, everyone, and welcome to APU's session. I wish you all well, and I hope that you are all safe in this pandemic. Let me start by introducing my slides, basically. All right. Now, fresh produce and the food industry people know that the fresh food supply chains are by nature very fragile due to the perishability and limitations of the shelf life of all the produce and products. Although Asia has seen the rise of corporate food production and processing, Asian productivity has traditionally been in the hands of small croppers and small and medium-sized growers. So, that next slide, please. Right. Okay. The agribusiness has been facing already existing challenges. One, you know, is basically poor harvest due to the effects of climate change, and of course, trade issues, an abundance of other problems. The COVID-19 issues brought upon us is missing parts to your HACCP, your food production supply chains. Is the missing SOPs that which we require for us to trade as per normal, and it closes off all our international borders. So trade issues actually, are impacted by all these restrictions, right? Even international movements and your interstate movements of transport and movement of cargo has been blocked. So our problems have been, obstructed. Of course, priority has been for the governments to focus on the medical aspect, the health aspect, but equally important is our food chains. So the enforced reduction of human interaction has brought upon us the myriad of supply chain issues. Now, putting restrictions on food production, food processing, and restriction of movement. Just as a matter of interest, so that it destroys your productivity from your production side all the way through to your retail side. Next slide, please. Right. So the other issues that we notice, this is a simple chart. It goes from the center, the core of the earthquake, and it moves outwards, right? So the first thing we look at is the fact that these are the industries that are going to be affected. In travel, air travel, land travel, ports like airports are also stuck, which affects tourism, and it affects any kind of industries related to it, i.e. the oil, the chemical industry. And you look at, I've got 4 directions that it moves out of. One is the non-food economy, which you see at the top. And we are talking about services, manufacturing, and the food and the material processing. But let us focus on the most important thing, which is on to the right, which is food processing, the F&B, food production, and also the food suppliers. With that impact on that, what is going to happen is that your A lot of food production and processing are impacted by the fact that we can't get our labor force, the skilled labor, into our production areas and the processing areas. We are also facing choke points, all right? And this, a lot of the procedures and protocols are actually ad hoc, okay? They are just implemented based on, oh, I discovered something, I learned something, and therefore I put it in. So as it is ad hoc, we have no standard practices as it were. So the existing idea of pre-pandemic inventory planning, staging, which we have been doing for continuous just-in-time deliveries, will fracture and would fragment when faced with these waves of demand, panic buying that is, caused by people who are not sure whether they're going to get their food, and so they go into panic buy, and that will destroy the carefully calculated buffer inventories, the buffer stocks that has been computed in computerized or planned data analytics and also algorithms. Next slide, please. Yeah. So when you look at this one, you see it now in the greater detail. Groceries, medical, okay, health and food are at the core of this. So let's look at the groceries and food, right? The most important thing that you're looking at is you're looking at the the issues regarding processing, production. You're looking at grocery items. Do we stockpile? We don't stockpile. Other new food items that we are looking at includes ready to eat. You find like your packet noodles, your ready to eat TV dinners and such being coming now into the forefront. Asians have traditionally been eating fresh food. All of a sudden, processed food, preset meals are now part of the new image that we require to do to plan for, right? Urban areas in lockdown. Yeah, slide 4, please. Next slide. Okay, urban areas in lockdown are often blocked to access of productions. We have had a lot of feedback that the cities are not getting the food, even though the food is just a hinterland away, just outside the city, at suburban and just near rural areas. So emergency restocking is part of the problems that we are now having to face at the moment. Okay, so what's happening is that people are doing emergency restocking. People are imposing quotas on purchases, and simply that the restrictions have caused even more panic. So the main problem has always been and always will be restocking of shelves in time. So we need to have also clear and concise communication to prevent people from panicking. Now, if people have also in Asia gone into cooked food deliveries, these have been overstretched, seriously overstretched, because everybody decided that, oh, it's easier, let me order cooked food. So when we move into this part of the issue, we find that there is nothing but fragments of things coming together, and food chains have been broken. Countries like Singapore, who depend a lot on imports, are particularly impacted. But even if you are an agrarian economy, between the cities and your growing areas, there is this big block. So let us look at what we're going to do next. We know the problems now. What we're going to do next. So we have proactive food supply security that we plan for. All right. Firstly, we know that this virus is not going to go away in the next 12, 18 months. So as virus mutate, the fear of infections will still persist. So our planning has got to meet the challenges that has got to go beyond the normal restoration of food supply chains in a short term. We have to now also to calm people down, put in and set in place enhanced protocols which will work together with your normal SOPs of food processing, ACCCP, what ISO and whatever you have. And additional to that, we must also add in the issue of last mile deliveries, because at that last point between the final retail and the consumer, that has been shattered at this time. Okay, when we are talking about re-strategizing, then we must establish a network, okay, of food production, okay, in urban areas, also to look at the available technologies. Okay, we also need to look at our technological skills, off-the-shelf technological skills, to have environmentally controlled food factories in the cities. We need to reorganize and reset again our distribution networks to put in contingency plans from farm to fork. Of course, without this, you still need to talk about the localized payment system, localized national payment systems, far and beyond your Visa and your debit cards, and go and have platforms that both monitor the supply, not only the supply, the sale, but also the deliveries and the payments all in one. Tracking and monitoring of food product environment. Remember, we are talking about perishable food, limited lifespan, to preserve the shelf life and to maybe in certain cases extend it. We have to have that right tracking and monitoring of its environment. We need also to incorporate emergency restocking and inventory staging using existing large retailers' database that they already have. This will help us to reduce the learning curve and get there faster. Right? So now let's look for the next slide, please. Okay, in summary, we have to therefore include all categories that we have set up. We have to implement the technology applications that we have for post harvest. A lot of people have ignored the post harvest processing. They just said, all right, I chop up my veggie and I bring it across. We need to really set to work the post harvest practices, both for planting, that is the fruit and veggie. We need to look at it as for the seafood, the abattoirs, and all that, to look at the post harvest so that we can extend at least a few days the shelf life of the food that we are about to eat. The next thing we got to do is we have to improve our staging and transportation network infrastructure, and this includes the cold chain. Sadly, a lot of people talk about the cold chain as, okay, I've got a truck, okay, I've got a cold room, and that's sufficient. I know I've already done it. The post harvest links together with the cold chain actually maintains the quality of your food and allows you to bring it to the final consumer in the mint condition which was grown or produced. Therefore, we need in the supply chain also upgraded SOPs for perishable food in all the areas, staging, storage, transport, all the way to the end, including retail. We need also to consider the timings and the scheduling with monitoring with and checklists. Why? Because we need to monitor and we need to map not only that, but also to have an overview of supply and demand. Right now, we are in a bullwhip situation. Those that need the kind of food that they want, they can't get it or not enough stock. Those that don't need it are getting that stock. So we see a lot of cases in countries where the farmers are actually throwing away the food because they can't ship it, they can't consume it, they can't sell it. So they're stuck with it. So we need to use this tracking and tracing and mapping out to actually have a strategic overview of supply and demand at district, at provincial, and at national levels. We also can use our handheld and wearable technologies in apps and everything else to do your track and trace, to monitor where the sources of supply and the sources of demand are. So again, we use technology off the shelf available for our for us to implement. Last couple of things that I'd like to bring up is the application of packing and packaging methodologies that we have for all our fresh produce and products. That technology is continuously upgraded and improved. But a lot of people look at it and say, that's too expensive, let's not do anything about it. But at the end, they contribute to your shelf life. At the end, they help you to reduce waste. So we need to tie that up with your next plan, which is a contingency planning for all your food security networks. All right? With all these things put back together, we look at what is now, the corrective action immediately, and the issues that are soon to come, all right, that we need to face. We cannot run away. Doing a short research on the pandemics, the earliest record of a virus pandemic goes off to something like 3,000 years BC, before Christ. Up to now, every century we've been having some kind of pandemic or epidemic, but we have never learned, and every time the same problems occur. Now we have the technology, now we have the capability. Now the next thing to do is build the capacity, and after the capacity, we at least help to mitigate the impact of the next the pandemic or even the next wave. Thank you.
Thank you very much, Dr. Rodney V,
Right.
for your presentation. I can understand what you said in your presentation because it is just happening around me in Japan. I want to introduce you some example. The first example is retail. Please imagine supermarkets. Labor shortage of supermarket became worse due to school closures. Many mothers are working there as part-time workers. But due to school closures, they have to take care of their kids at home. Another problem is additional jobs on supermarket staff. They have to disinfect shopping basket and elevator buttons, put masks and transparent plastic sheets to minimize infection. Furthermore, supermarkets are more crowded compared with before the pandemic. Instead of eating out, people cook and eat at home. And instead of going far, like shopping mall, people go to neighbor shops. And most important is, supermarket workers are at the higher risk of infection from other people. The second example is transportation. Please imagine truck drivers. In Japan, patients are concentrated in urban areas such as Tokyo and Osaka. So some people misunderstand truck drivers carry virus from urban to rural. According to the media, some drivers got some discrimination and harassment, such as reasonless criticism and scratching truck. Such kind of things are actually happening. I think food supply chain players are now facing various hardship. What do you think about this situation, Dr. Rodney V?
Hi. Yes, very understand. Let me. Oh, you have a very long two questions all put together. Okay, I'll go it step by step. Based on feedback from supermarkets, big retailers, and also feedback from the freight association and people who are involved in the transport and supply chain industry. This is what answers that I hope to be able to give to you. One, let's start with the supermarkets. All right. Um, the supermarkets have and other big food retailers have been desperately employing, I say the word desperately and I mean it, temporary staff from other organizations, those that are suspended or have lost their jobs because they were classified non-essential. And people, for example, people like F&B outlets that have been closed, airlines, etc. Yeah, they are familiar with food, so they have been hired to actually stand in into those big retailers to assist in the retail outlets, and so that these poor um, mothers, as you said, can stay at home and look after their children, because if not, there's no childcare or whatever. And because these people have some background of F&B, it is easier to shorten the learning curve, and then they are ready. Others have been hired also in storage and distribution centers, because don't forget, delivery is also done from distribution centers or online e-grocery directly to homes and to whatever locations that people order them from. Yeah, like in cases like hospitals and such, right? So there is a balancing. These organizations say they have a balancing act to do. They have a core of existing staff, well trained, so they have to make teams to blend between the old and the new, to allow them to, to deliver the services that is required of the online buyer, and in some cases the customers that actually can go to your convenience stores and your supermarkets. Yeah, so on the job training now becomes an norm. There's no time for classrooms, there's no time for other fancy training. OJT is in and remain in force until the restrictions are lifted. Extra shifts have been added, and increased team sizes have been there to handle the extra work, the sanitizing of the shopping basket, the trolleys, and all other extra work, including replenishment of shelves. Furthermore, these people are also given uh, extra help, like personal protection gear or face shields, face masks, gloves, sanitizers, and these are also placed in key strategic locations in their premises, so that they will allow them to work comfortably and safely. They have also installed emergency plastic or perspex barriers at cashiers counters, at self checkout counters in between, to have that 1.5 average distancing. So they also limit the number of shoppers in any outlet at one time, and are recording details of name, mobile data, date entry, date exit, for contact tracing. Okay, in some cases including QR codes. Additional staff have been also hired as security to guide the people in and out, and to manage all these things, that is occurring. So these are the things that are happening for retailers and supermarkets. The next one is your issue of transportation. We understand everybody's fears. The biggest fear in everybody's life is the fear of the unknown. What you know, you're not so frightened about. What you don't know, you're very frightened. And this virus is a lot of unknowns. So it's the fear of the unknown that psychologically is one problem that's difficult to handle. And it's not only that the truck drivers and those who are in the logistics industry that's facing discrimination. Delivery, food delivery riders, uh, the people who are out there in the forefront, making sure they get food, they are always being faced. But also people who are in the medical and then healthcare industry, who are in the front line, doctors, nurses, are discriminated against and are even attacked, as even when they're not in any hot zone. You see, that is the fear and the human behavior that is affecting us all. So this is where civilized behavior, as you and I know it, becomes irrational in the face of this type of fear. Sadly, not only do the truck drivers face this discrimination outside, but it's also in their journeys, when they have to do long hauls, long distance from one end of Japan to another. The truck stops which has F&B and all are declared non-essential, and because they are not essential, they are supposed to close. So the truck drivers have to face uh, rest stops without toilet, without wash area, without any kind of food, anything. Fortunately, there are instances where truck stop operators have kept part of their facilities open to provide takeaway, and to open their facilities, properly sanitized, of course, for the truckers to use to wash up and clean up and for their ablutions. Yeah. And but most of all, I think when you look at both your questions, the issue here is social media. Irresponsible reporting and comments, rumors, conjectures, and guesswork is part of adding to people's fears. Government agencies can actually play a part in communicating educational information and guidelines accurately and at regular intervals to the public. Recommended and even enforced measures to take when protecting themselves. See, look, if the truck driver has gone for his swabbing, tested negative, is wearing his mask, he has proper protective material, he's following some procedures that are recommended, then it should be a comfortable human to human contact, and, and this sort of clear cut information should be clearly given so that if any uncertain issue, the authorities must err on the side of safety first. The idea there is to reduce the level of fear from the public. Does that help you with your question?
Yes, thank you very much, Dr. Rodney. So from now on, I would like to begin Q&A from viewers, but not so many questions. So I would like to introduce one question from Stephanie. Please listen, Dr. Rodney. Could you please share on IT-based system of tracking and tracing food demand and supply?
Put the IT-based system on track and trace food demand long and long. Okay, the food demand and supply. Basically, the governments or related agencies should be doing this planning. In big countries, example, big agrarian agricultural countries, Indonesia, Philippines, Vietnam, they have got big pockets of production everywhere. But right now, there is no centralized, whether it is at district or provincial at a national level. They don't have enough information to know which district at every season is producing what volumes. They get a bit of estimates, but nothing that is an overview. Okay, so if you have a large database, you are able to say, all right, this food needs to be grown here, this has not been grown here, maybe we should grow it. And so this requires a lot of manpower. The idea of having an IT based record is so that you can actually have an overview. It's not an easy task. I do not tell you it's going to be easy, but it can be done. We can have a proper planning for the country, or at least in each district, so that when the central authority asks for the information, they get it straight away. We can then also plan that if what is favorably grown in this area, say example, I grow these type of leafy vegetables in this area, but it's not grown in the other area, but the land and the climate is suitable, then we may want to diversify the production areas so that we could supply to the neighboring towns and cities and don't have to do that long haul trips for all the transporters. Um, I don't have any system to recommend, and I wouldn't recommend any system because it's not my duty to recommend. I just say that it's got to have something like that. I don't know whether that will help, but if you have any doubts, you're welcome to send your detailed inquiries to APO, and I hope to be able to answer in detail. Thank you.
Thank you very much, Dr. Rodney Wee. So today we don't have many questions from viewers. So I would like to continue discussion with you from my side. So could you please listen? People are recommended to stay home, don't go out. That is critical for restaurant owners. Even though they have no income, they have to pay rent and salary. In Japan, the restaurants which sell box lunch are increasing. In addition, food delivery is also increasing. So, do you have any good idea for restaurants to survive?
A very good question you asked. If I had the miracle answer, then I would be a multimillionaire or a billionaire. Unfortunately, at this time, takeaways are the only answer to help them survive. Just having said that, there are thousands of small F&B outlets which are actually closing down. Some of them are very famous restaurants and cafes that cannot survive in this lockdown. So the only answer at this time is to diverse their in-house or in-dining and move to more takeaway, catering, uh, supplies. In other words, I would say maybe market that I can supply to a school which canteen might be closed, and say, all right, there is 500 students over there. I would supply lunch or break, uh, 500 bentos every day for as long as the school remains open, or even certain essential services like hospitals, like some other frontline essential services, which have people have to be at the job but cannot get food from outside. So that might be an answer. I don't know, but I hope it works.
Thank you very much. So, fortunately, in the case of Japan, Japan is not experiencing a lockdown situation as of now so far. But lockdown situation is something like scaring for food supply chain, I think. So, under lockdown situation, how should we maintain food supply chains?
Uh, you want to have the emergency version, or or hopefully not so emergency situation. If it is an emergency situation like maybe a disaster, not just a pandemic, but a disaster, say earthquake, then I would mobilize all civilian and uniform organizations, the military, the police, and also the civilian resources, where I would mobilize all their transport, their drivers, and actually set under a centralized control. I would collect from all the, because now I remember I have the IT based system where I know where the supplies are and I know where to get them. So I can send my vehicles and my manpower to collect safely, bring it into the lockdown zones safely, and then plan distribution. But then we also need big data. I need to know how many people each uh, uh, each small zone, per household. In some cases, the per household may be they need Muslim halal food. This household maybe are all vegetarians or vegans, and so in order to have that, you see, people talk about privacy issues, but in an emergency, we need this information. If not, we are unable to create to modify our supply chains to feed you. Does that help?
Thank you very much. Now I got one question from chat box from Udana from Sri Lanka.
Right.
How can we ensure that the delivery of online ordered foods are safe to consume during the pandemic?
Okay. This becomes a food safety issue. We're talking about our HACCP, our ISO 22000. And if even before we're talking about the pandemic, if the cafe or the food source has been practicing correct HACCP uh, plus, say, uh, COVID, ad hoc protocols such as constant washing of hands, sanitizing, proper cleaning, maybe steaming of utensils and such, and cleaning of the packaging. When we do that and we actually put the food into proper insulated containers and bring it to your consumer, I would say about 95 to 99% food safety is already applied, and it's very unlikely, with less than 5% or even less than 2%, you would get a food safety issue here. Sri Lanka, I'm not very clear. I hope one day to go there. But that's when you start talking about food safety plus the food safety and a plus to it for your food delivery. The problem is sometimes because when you deliver to an area and everybody looks at the delivery man and says, "Ha, are you sanitized? Are you?" And he cannot prove. He cannot prove that he has been sanitized and all that. He can carry his sanitizer, he can wear his mask and his face shield, but there's no certificate. And so because of that, they delay him. And because they delay this delivery man, the food maybe become cold, maybe the food is exposed. I'm not sure. But this is the 2% or so error rating that you will find when people in a pandemic actually delay the whole process of delivery. I myself had experienced that food deliveries have become delayed as a norm. Yeah, that helps, Sri Lanka.
Say again. Sorry, my was. I repeat once again. So if somebody is infected, not only the patient, but also all people living together must stay home more than 2 weeks.
Yeah.
But they have to buy food. Do you have any good idea for them how to buy food or how to offer food for them?
Okay. Even if they are not in lockdown, the same procedure can apply. When you can order food online, if you can afford it, you order the food online, and then the food delivery person will come and put it outside your door. Okay, about a meter away from your door. They can call you over the mobile phone, and then step back. He already took a photograph with his mobile phone that he has delivered, and then you step back and call you, and you come out and collect it. Whether you're infected or not, this sort of simple protocols should be already standardized. Yeah, that's one way of doing it. But if you have a case of a zone that is infected, and we know that it's infected, if we need to send anybody in to deliver food, we're going to make sure that they have full protective gear. I think that's to be fair. The guy that's going in there is going to take a big risk getting infected. Nobody wants to get that, no matter how much you pay. So we need to give them full protective gear, a full suit, like as if you're going for hazard warfare. Give him a full suit and let him deliver. After that, he comes out. You radiate him. You do whatever you think necessary to do to wash him clean and make sure you dispose of the protective gear. That could be part of the procedure.
Okay, thank you very much, Dr. Rodney V. So, from me, the last question for you, it might be a little bit big question for you. So, what is your evaluation of coronavirus impact on food supply chains in Asia as of now? COVID-19 infection was spread worldwide, and many countries declared national emergency, but severe lack of food was not reported. I think Asian food supply chain is working well, I think. So what do you think about Asian food supply chains under the pandemic?
You want the inside story, Watanabe-san? A few countries, I won't name them, have restricted exports because of that. Some of the countries have stated that they want to control the exports because they got to feed their people first, and that's fair. That's very fair. And the food supply chains have fractured. Definitely, Asian countries' food chains have fractured, right? And people are frantically going to figure out how to get around that. Uh, that's for international. That means within country to country. Within the country, it's also fractured. I have reports of several major countries where the food is just outside the city and they can't come in because that particular area has a cluster and they block it. So I would say that by and large, we are lucky that because Asia is not not because that they are not having it. They are not reporting it accurate because they want to instill confidence to the people that some things are still going normally, and nothing wrong in that. What we got to do is now, because we have got overcome the first wave, we have to now plan, as according to what I have given, ideas of which to use to meet the next, maybe second wave, maybe third wave, or maybe this is going to be a long first wave and then it goes down and then it comes and hits us again, or some other virus will hit us again. I don't know. Nobody knows. But I can see that for COVID-19, we are talking an easily 12 to 18 months of nothing really happening in terms of finding a solution. So we need to use this time to do the emergency action. Look at alternative sources of supply, implement it. Whether it costs us more or less, it doesn't matter. Feed our people first. And once you have fed the people, then start repairing all the fractures, all the broken parts, put it together and improve on it. Does that help?
Yeah, thank you very much. I appreciate your comment. So time is up. So I have to finish today's productivity talk. So now I would like to appreciate Dr. Rodney Wee for your wonderful presentation and comments. And for viewers, I hope today's talk is interesting and beneficial for you all. Thank you very much today for your attendance to our productivity talk. See you again.
Bye.